Our first series welcomes topic experts using the ISPA 8 investments to frame the conversation, showcasing Scotland's whole systems approach through a long-term health condition lens.
Hello and good morning and welcome to you all today. This is the Movement for Health podcast, series 1, and Movement in Conversations. This theme today is active workplaces, and I am joined by 3 experts in the field in different guises. I'm joined by Sam Warne from St Andrews University. Hello, Sam. And Sarah Turner from Paths for All, my colleague there, and Louise Cullen from Seafish, HR professional. And I should say Sarah looks after the Step Count Challenge national programme and the Walk at Work Awards. I managed to say it this time, which is great. And Sam is a researcher in this field and has worked with Paths for All and other organisations looking into this work. Welcome to you all and thank you for joining me today. We're here to talk about active workplaces and spaces with the new Scottish Government's active framework for physical activity and health. We see a real shift in narrative around the importance for more movement in all walks of life, in as many places and spaces in our lives as possible. So today we're lucky to be concentrating on the workplaces aspect. Thank you. I'd like to start us off by maybe exploring some of the science behind it, some of the research, and I'd like to welcome Sam at this point to maybe give us a little introduction to some of the work that you've been involved with, Sam.
Yeah, that's not a problem. Thank you for having me. So, as you mentioned, I work closely with Sarah. I have worked closely with Sarah over the last, must have been 4 years or so now. So my PhD was all based on actually sort of looking into the Step Count Challenge, which I'm sure Sarah will be able to give you far more information on than I can still. But it was, we wanted to actually look to evaluate the science behind how it was working and sort of the experience of the participant as a whole. So I'm sure it's come up in every other podcast as well. Physical activity levels. For everything great that physical activity can give you, health and well-being wise, for some reason we still don't do enough. I think the latest worldwide figures were for high-income countries we're at about 37%, which just is just not good enough. And so thankfully, is people like yourselves at Paths for All that are doing the good work in trying to make sure that people do start doing more. But it's, I guess, my job to help put the theory behind it to make sure that all the initiatives that you guys are creating actually do help. And so that was what we looked to do. Myself and my supervisors, Gojda Ozakinci and Jamie Ainge, we had a preference for the COMBI model of behaviour as our sort of overall framework. So just to give you sort of a brief overview of that, it's the suggestion that for any one behaviour to occur, you need to have the capability to do so. That's physically and psychologically. So actually believing that you can do it and having the physical capability, I suppose, actually being able to go for a walk or whatever. The opportunity to do so, again, being the physical opportunity, whether that be if the weather outside is okay, if you have the time to do it, and also the social opportunity, if you have people to go and do it with. Not everybody likes to exercise by themselves, but crucially it's the motivation to do so. And without sort of a combination of the capability, the opportunity, and that real motivation to go and be active, is really unlikely that behaviour is going to occur. And so that was the overall framework that we looked at the sort of the Step Count Challenge with. We did we did some qualitative and some quantitative work. We actually ran, I think 3 or 4 studies in the end, wasn't it, Sarah? Actually with the participants, tracking both their physical fitness, their mental well-being, and we also did a couple of pilot studies about cognitive work as well, as that started to come through in the in the overall field. And then we also obviously did some actual interviews with the participants themselves who had just finished the step count challenge to sort of work out what it was they enjoyed about it and what worked for them, so that we can try and work on these things in the future to make sure that we keep the aspects that they enjoy, and we can develop the things that they want. So I'm not sure. Not sure how deep you want me to go into the science. If you want me to go straight into research, if you want me to give a bit more background around sort of theories, or
No, that's lovely. That's a lovely introduction. Thank you, Sam. And I know that there's lots of good evidence showing that workplaces that have their workforce's health and happiness as a core value to their work and their ethos as an organization see better results in terms of less days of absence, longer stays of professionals within the workplace. People are genuinely happier within their work when they know they're invested in as well. So being able to almost, I suppose, have permission to invest in themselves by moving more, whether that be through the sort of competitive landscape or national programs such as the Step Count Challenge, where you see these sort of peaks of interventions, or whether it's something that what we'd love to do, I think, is encourage workforces to look at their structure and ethos and see how all types of movement can be encouraged, because we know that everyone moves differently and different have different motivations, and what works for some people won't work for others, and it'll be the same within the workforces. Before we move on to the practical elements of what that might look like in an organisation, Sarah, I wonder if you want to come in there and talk a little bit more about our national programme of Step Count Challenge, but also the Walk at Work Award as examples of sort of national approaches that organisations can look at.
Yeah, sure. So I'll take the Step Count Challenge first of all. So the Step Count Challenge is a workplace-based activity challenge. And how it works, in essence, teams of 5 colleagues sign up online and track and record their steps over a set number of weeks. We run 2 national challenges a year. So we run a challenge in the spring, which lasts about 8 weeks, and we run a challenge in the autumn, which lasts 4 weeks. Our autumn challenge has actually just kicked off this week. Got 547 teams taking part, which is great. And in addition to our national challenges, we also run bespoke Step Count challenges for workplaces. So workplaces can come to us with an order for a very specific set of dates, a specific length of time, and they can invite all of their colleagues to join in. People can link activity trackers to the website when they're taking part in a challenge, which has become increasingly popular lately. People use things like Fitbits and Garmin's to record their steps. Activity trackers generally becoming more popular, I think, and it's just a really useful way for people to be able to keep track of things. In addition to that, though, accessibility is really important to us. Got the option for participants to be able to log their steps manually, and we also have options available for people who might think that an activity challenge isn't for them. So people who maybe have health conditions can also take part in the challenge too. Got lots of different activities that people can record from. We have walking and running and cycling, but people can also record swimming and yoga through the website as well. So we try and keep things as accessible and inclusive as possible for people to take part. We like to sort of, although it's a competitive challenge, we try and kind of play up the, anyone can take part kind of angle, just to really encourage participation and to really make people feel welcome to take part in the challenge. So going on to the Walk at Work Award briefly then. The Walk at Work Awards is a workplace accreditation awards, which workplaces basically can work towards a series of 5 actions. Those 5 actions are across 3 different themes. So we have actions under walking facilities, walking culture, and walking community. And workplaces essentially choose 5 actions from across those 3 themes, and then they take a period of about 6 months to work through those actions. And so they can be things like setting up a lunchtime walking group for staff, for example, or potentially taking part in a step count challenge, or even simple things like making sure that information on public transport options is up to date for staff and visitors to their workplace. So yeah, both the Step Count Challenge and the Walk at Work Award are really, really popular interventions. Step Count Challenge has been running since 2013, and it's never been more popular than it is now. The Walk at Work Awards, we have just awarded our 50th Walk at Work Awards this year, and that's been running since 2018. East Renfrewshire Health and Social Care Partnership achieved the 50th Walk at Work Awards earlier this year. So yeah, there's plenty of appetite out there for workplaces who are interested in encouraging their staff to be more active. So yeah, it's really great to see.
That's lovely. Thank you, Sarah. We'll come back because I've got some questions about what might the barriers to some of these things look like for organisations to think through, and who are we attracting to those national programmes, and then who are we still to reach. We could maybe think about that as a group as to what that could look like in terms of thinking about some of those challenges to get more movement involved. And the environment as well. We recorded a podcast earlier on this week around the education environment, and we were talking a lot about technology and like standing desks and treadmill desks and things came into our discussion there. So I'd love to pick that up as well. But Louise, I'd love to welcome you into the discussion at this point to maybe help us think about what this looks like on the practical end, the implementation end within a workforce. I wondered if you could maybe just give us an example of the workforce that you work with currently or have done in the past, types of jobs, and then the types of interventions or things that you might have discussed putting in place. What's worked well? What's been more challenging? We can unpick some of that.
And thank you, because I'm already taking lots of lovely notes about what you're talking about. I was playing to that idea of opportunity, Sam, that you picked up. I think that definitely resonates with our team about providing a wealth of opportunities for people to get engaged and motivated around some of these interventions. Got a workforce of 90. They're spread across the UK, so we cover the whole of the UK. Geo roles, Seafish are the arm's length government body for looking after the seafood industry. So we provide a lot of different services, including data regulation, safety training, all of that good stuff that helps keep our fishermen safe and helps them make lots of money for themselves and keeps a very buoyant industry good and well. But for us, it's a different challenge, I suppose, in that we have people, one, across the UK, a lot of people working from home. We do have 2 offices, Grimsby. After the pandemic, obviously, everyone's spread far and wide and tends to be behind a desk somewhere, if not out on the quayside, speaking to fishermen. So it's a really weird and wonderful group of people. Also have all of the generations. So we've got people right from like age 20 right up until retirement age, about 65 to 70. We have a range of things to try and consider around how we work as a culture. So one of, I suppose, the most important things for us is we have something called trust and performance culture. So that means we don't work a 9 to 5. It means that we have a very clearly defined set of objectives that we all have to get through to achieve the organisation aims. And how we do that is up to us. So what that gives us is a really grown-up way of working, but it also gives us that space and that permission to what I think one of you said, giving people permission to do these things, feeling they have permission to do these things and have the space to do them. So we hope and we know from feedback from people in our team that they use those spaces and they use that way of working so that they can get out with their dogs or go for a cycle or be up on top of a hill or whatever that looks like for them. So I think that's key. Secondly, to your point around kind of accessibility, I think certainly for us, this year's Mental Health Awareness Week, which was around movement for mental health, we always do Mental Health Awareness Week. And we found movement being a challenge. So to your points about opportunities for all to kind of engage with that challenge, we did get some feedback about, well, I don't think I can do that because I don't want to come online and do fitness, or actually I'm really immobile and I'm finding it tough to engage with the idea of movement. Now, one of the things that we try to attend to is that notwithstanding movement doesn't just have to be physical. Movement can be gut health. Movement can be slow and gentle. Movement can be a way of just getting out on your horse or being in your wheelchair wheeling, whatever movement feels like you. So we tried to think of moving mind, moving work, moving physically, moving your gut. So we tried to think of different ways. And I think your point about how many, can you give people opportunities for it to be accessible and make it easy that they can connect and engage? I think absolutely these are things that we've tried to employ this year. And then one of the most successful interventions, just to finish, is that we did a walk a mile a day in May, a challenge for the RNLI, and we had a third of the organisation get involved in that, and it was really competitive, and people love that element, don't they? Which is why your work works. CEO and our directors on there, so I think leading it from the front as well, you've got to have those leadership teams involved so that they can really give that permission to others to say, do you know what, if you want to do the mile a day, get out and do that. We are all doing it too. I think that really works. So
Lovely. Thanks, Lou. I picked up loads from that in terms of examples and chunks and nuggets we could maybe talk through together as a group. I'll start with the last point that pinged in my head when you said leadership. So we could just explore that permissions piece a bit. And I know there's been a lot of work around workplace culture and leading by example and leading from the front, and things around like not sending emails in the evening and stuff to staff from the leadership as well, to sort of set that really good example of manage your time, and your time is precious, and you should have that balance. So I'm wondering how important that is then when we're looking at programs, Sarah, like the ones that Pass for All lead on and others nationally. What conversations do we have with the leaderships of organisations to prepare for these types of things, or what could we maybe do in the future to see maybe more influence with some of this work?
Yeah, no, that's a really interesting question. Typically, the people who order step count challenges from us and the people who get involved in the Walk at Work Awards from an organisation tend to be the sort of members of the HR department, sometimes health and safety as well, department get involved. A lot of the time they are on sort of a desire from senior management to sort of try and encourage staff to be more active. The other interesting motivation at the moment is that a lot of senior management teams are looking at the carbon footprints of their organisation, so they're interested in encouraging people to travel more actively. And so that's another sort of element to the whole picture. Yeah, in terms of direct conversations we have with CEOs, going back to the 50th Walk at Work Award celebration that we had earlier this year, we had the CEO of East Renfrewshire Health and Social Care Partnership joined us for that celebration, along with our own CEO, Kevin Lafferty. So it is something that CEOs want to be seen to be encouraging. And And it is certainly, there's multiple reasons why a senior management team might be interested in encouraging staff to be more active, whether that's from an environmental perspective or a health perspective. From just the perspective of the Walk at Work Awards exclusively, one of the elements of the Walk at Work Award, as I mentioned, is the walking culture category. And the actions within that are very much aimed at creating that kind of permissive culture within a workplace, so that people they feel like they can just get up and go for a walk for 10 minutes to clear their heads and to stretch their legs. But it's definitely a bit of a work in progress. With the Walk at Work Awards, we're currently doing a bit of a review process at the moment. And one of the new actions that we're looking at doing is including an action asking for some kind of commitment or pledge from the senior management team to encourage staff to be more active within the organisation. So, yeah, it's definitely a work in progress, but we're hopefully getting there.
I think that's great. I love the idea of a pledge, and I'm very much about leadership being very representative of these types of things. And Sam, I'm just wondering then if there is anything you're aware of within the research around if there's a difference, if that makes a big difference in terms of having that leadership and that permission piece, maybe from senior management, and buy-in to people doing just that and walking the walk as you like. Do you know of any research or examples of stuff like that you can think of?
I know it's certainly a growing area. I think someone mentioned it there. It's that the fact that we're working from home a lot now as well is a huge thing. So I'll just throw some stats out there. So we spend 60% of our. It's been estimated we spend about 60% of our the time we're awake in the workplace throughout our lives. In the UK, we're at 84% of that time we spend at work is sedentary. We're not moving. Also, from the that 84%, is the UK, but that's also the same for Australia, the USA, Canada. We're all the same. But then, research from the UK alone found it was less than 15% of workers actually do any physical activity at all during the day. And then that's actually been seen that it's even less when we work from home. And there's more people working from home now more than ever. So it's becoming a really crucial thing that needs researching, which is, I guess, why we're having the conversation today. That then it was something that actually, although I don't know of any direct research that's done it already, it was something that actually came through in the interviews we did, where people were saying that actually it was one of the things they valued the most was about the challenge was the fact that it was they couldn't be told off if they wanted to go for a walk, because the higher ups were the ones that had given the green light for the challenge, and they wanted their staff members to go and be more active. But like you said earlier on, it makes perfect sense for the higher ups, for the people in charge, to try and implement something like this, because a healthier workforce down the line leads to more productivity, leads to probably increased income every year. It's a cyclical process, but someone from the top needs to show leadership and actually take that initiative.
It's really interesting. So how do we influence that more, I wonder, in terms of who could we be speaking to about the importance of this more? Because I don't think it's something that isn't known necessarily, but it's about how to influence priorities, I guess, at an organizational, cultural level, which is tricky, and doesn't happen overnight, as we know as well. Lou, I wondered if I could ask if you had any thoughts on avenues to influence the wider representation of workforces. So in terms of networks or groups that meet and share this kind of knowledge and research, and if there was opportunities for doing that.
Definitely is. I think there's pockets of activity, and I think getting those people together. So, for example, one of the pieces of work I did was a CMI qualification in strategic well-being, and part of that is, strategies, just as we were talking about, to get people moving. I mean, obviously they include other things, and as you said, Sarah, some of those professionals are health and safety professionals, because we've got health, safety and well-being. That has to be a huge consideration from a duty of care perspective. So there is that duty. People do know about it. Is important. I think your sustainability link is very helpful to that, because as an arm's length government body, we have public sector duties that we have to report back on into our bodies like DEFRA. We have to say what we're doing. So we've got greener government commitments, which will talk to that sustainability point. So from a government perspective, there's almost like I can see really clear linkages where that can be not enforced, but say this is actually really important and this is why, and this is what it ties into. Influence. But I think there's also gather up those people that are so about it and get them in a room together. You might find that you create something quite powerful. I don't know that place is yet. I think, if you think about anything HR related, it's the CIPD and getting them together, and they do pockets of activity and discussion around it and research. And you'll probably get the same in the health and safety networks. But if you could get them together from a kind of national agenda, kind of who wants to be involved, I think you would get a lot of really good voices in the mix with lots of great experience around what's worked and what hasn't worked. And even today, just speaking to you guys, I've picked up little things that I kind of want to start building into my strategies. So I think, those conversations are really important to try and drive that forward.
Excellent. Lots to think about there. I wondered about going back to the accessibility question, or just picking that back up with Movement for Health specifically. We look at how people that live with chronic conditions, long-term health conditions, can move more. Those individuals are far more at risk of lots of different things due to their conditions, due to opportunities, and just due to having a lot more barriers in place for many aspects of their life. We want to focus on the power of movement, and so that everybody has the right to benefit from moving more, whatever that looks like for the individual. Now, I don't have the statistics to hand actually about the workforce in terms of long-term health conditions and those people that are in employment with long-term health conditions, but there will be many. And I wondered how we think about that accessibility. Sarah, you've already touched on making the definition of movement more accessible within those national challenges and what people can record. Lou, you also mentioned, though, that even by using what we think is a very accessible word in terms of movement, so movement for mental health, there was still some barriers there for people, even using those types of communications. And Sam, I don't know whether in the research that sort of, if that's extrapolated when looking at people living with health conditions in the workplace, if maybe that's an area that we could consider what that could look like. But yeah, I wondered if, just to open it up, if people had any thoughts about how national programs and then workplaces themselves, what is being done specifically to support those people in the workplace that are living with long-term health conditions, to take into account, but not just to do their work, but just for them as individuals. Any thoughts? I invite.
Mind jumping in if
Thanks,
that would help. Just from I know through our data of our people, we've got at least 22% that are living with a long-term health condition, whether that's mental or physical. And you know that by engaging with those people, going out and actually speaking to them, and we love a pun, so all of our engagement activities around place, PLAICE. So we've got place to talk, place to learn, place to pause, which has been a really great intervention this year, allowing people to do whatever they want in that pause. But one of the things we have been doing is, and again to your point about building connections with people, whether that's leaders or others, building connections on an individual level and understanding for them what movement means for them and how that helps them. So not saying, hey, this is what we're going to do as a blanket thing, but actually starting to work with individuals and say, okay, well, how would that help you, even if it's on a very gentle, very basic level? How much does that bring joy or your world and your working day or elsewhere? And I know working with an individual recently, giving her the time to go to a Pilates class when she's dealing with quite a serious health condition has been like dramatically difference in her life, in her weekly life now that she's doing that. So for me, it's definitely individual. It's not something that we've done as a workplace, right? We're putting on a Pilates class for everyone. It's about going what works for you and understanding how that can benefit you with the condition you have or the challenges you might face.
So meeting the person where they're at and listening to their scenario is really important. How do we do that on a big scale in terms of, so you have 90 employees within Seafish. When we're looking at the thousands, the tens of thousands, etc. Sarah, what's the largest workforce that we've worked with for the Step Count Challenge?
We wouldn't know exact numbers off the top of my head, but we do work with various health boards and also local authorities often have quite large workforces. We've currently got a few teams in the Autumn Step Count Challenge from Glasgow City Council, and they have a workforce of many, many thousands. So yeah. But just touching on sort of, how do we do that on a big scale, that accessibility sort of thing? I think the Step Count Challenge and the Walk at Work Award, one of the advantages we have through both of the programs is that both of them allow people to sort of select what works for them, what feels right for them, and the Step Count Challenge through allowing participants to select various different activities, which they can then convert into a Step Count equivalent. The Walk at Work Awards, we do that through presenting sort of very many options for different actions that workplaces can take part in, and we're not prescriptive. So we say to workplaces, choose which actions work best for your specific workplace, and then just sort of take it from there. And we sort of make a point of saying we're on hand to offer advice, support, and resources, but we're not there to tell people how to do things, if that makes sense. It's very much a advice and hand-holding kind of role that we take on with the Walk at Work Award.
Absolutely, because it has to work for the workplace just as much as it has to work for the intervention and the individuals. So there's a real balancing act between that. It's a real skill, Sarah. Thank you. Sam?
Yeah, so I was actually going to, basically echo what Sarah's just said there about the Step Count Challenge being the accessibility aspect there. It caught me by surprise when I was researching the challenge that actually how everyone seemed to go into it with a different mindset. I somewhat naively assumed everyone was like me and was just really competitive and just wanted to win regardless. I was ready for national domination. I was going to beat all my teammates. I wanted to beat every single colleague, and I was going to do the most steps anyone had ever seen. And that
I'm going to join your team.
That was my outset. But it was actually speaking to people and sort of really trying to break down the Step Count Challenge into sort of all the little sort of behaviour change techniques that are present there. I think we ended up finding that there was sort of over 20 of the 40 registered or recognised behaviour change techniques are actually present in the Step Count Challenge, and you can apply them however you want. But it was things like, so to go back to the competition bit, there was people I spoke to that actually said, I didn't care about anyone else on my team. I just wanted to beat myself. And it's one of the things that Step Count Challenge provides. It's not only it's that bit of you see the graph in front of you. You have that accountability of, this is where I started. I'm on the upslope. I've set my goal. It congratulates you when you achieve that, and then it uses the algorithm to say, right, well, if you've done this in 1 week, you can improve it again by next week. And it's like Sarah said, it's like a hand holding tool to almost say, right, you can do this. You are doing this. But it really did strike me that some people do just want to use it as a way to improve their own activity, and not really worry about the rest of the competition. That was something that really surprised me, but I think is something that could be implemented if you wanted to implement it for people with long-term conditions. You could put the emphasis on that very easily, and it wouldn't be an issue at all. But I think that feedback, that all the graphs, all the badges that you get for it, all the little accomplishments, sort of a pat on the back every time you do something great, it goes a long way. And I think there's all the little nuances of the step count challenge that people don't maybe acknowledge so much can actually have a big difference for people that aren't being super active all the time.
And what about the outcomes, Sam, then from your research for the organisations themselves? How do we converse with the organisations to see what the overarching outcomes have been for their? Have they seen any changes for them in the productivity or the staff well-being, or how is it reported?
We haven't done anything in productivity ourselves, and in the PhD work, I didn't speak to any of the organisations as such, but off the back of that, Sarah and I did also do work with NHS Grampians when they did a bespoke challenge. So that was, correct me if I'm wrong, Sarah, I think it was a 4-week challenge was it January or February of this year? And their big thing was the mental well-being aspect, and it was that tracking it, that they end up tracking it even a little bit longer after the step count challenge finished, and it was consistent with the things that I found during the PhD research of the entire the entire population that I had, which was in the end, I think cumulatively ended up being around 1,000 people. That there was a quite a significant well-being increase from start to finish. I can't remember the exact stats from the Grampians sample, but the sort of from the first study I did in 2021, it was almost 12% increase in each individual's, or on average, obviously, in an individual's mental well-being score on the scale, and so that's the sort of output that we were looking at, and it was, I think, across most of the studies I did, that sort of 11-12% mark for mental well-being increase was it was around that for everything, which is obviously it's quite significant. Well, it certainly was statistically significant anyway.
Thank you. I'm wondering then about behaviour change and the longer term behaviour change, and what evidence we might have around the correlation between taking part in an intervention such as step count or anything else, Lou, that you've done within the workplace, and those individuals' longer term gains or behaviour changes from that. I know from reading a lot of the case studies and stories that come out of the step count challenge about, it can have long-term impacts for some people and introduces them to new social aspects, new friendships, new relationships through the camaraderie of taking part in a team activity at work, and then also just that finding a love of walking. And there are some people that have just never walked really much before at all, who have really it's been quite transformative to their relationship with walking and making that part of their daily life and things like that. So I just wondered if maybe Sarah, if you have any examples of that other than what I've just said.
At the beginning and end of every challenge that we run, we have a pre-challenge survey at the start, and then we have a sort of post-challenge survey at the end. Pre-challenge survey from the spring 2024 challenge, we always include a couple of physical activity themed questions within these surveys. We know consistently over the last few years that taking part in the challenge increases people's physical activity levels from the pre-challenge survey point to the post-challenge survey point. And for the spring 24 surveys, we asked the question in the past week on how many days have you been active for a total of 30 minutes or more. So that's touching on the physical activity guidelines of 150 minutes moderate activity a week. And there was a 24% increase in the number of people who responded that they were active on between 5 to 7 days of the week at the end of the challenge. So there was 72% of respondents to that survey told us that they were active on between 5 to 7 days of the week. So for us, that's a big tick in the box, definitely. Sam's research shows that basically there was over the 3 studies that you did, Sam, correct me if I'm wrong, but you had that physical fitness measure showed that there was a statistically significant increase and that was consistent across all 3 studies as well. So there is that long-term impact of sort of increasing physical fitness and increasing activity levels. And the challenge does sort of have that impact on, purely on a physical activity and physical health kind of basis. Those improvements are there, and we are able to measure those.
That's lovely. I'd love to know more about the mental health impacts as well, and the social impacts for staff from taking part in these things. I think that's really interesting. Thank you. Lou, I wonder if you have any examples of, within the workplace and within your role and roles similar, in terms of tracking change, or is that something that workplaces feel able to do and monitor? Is that of interest?
Survey after any activity that we do, especially around Mental Health Awareness Week. We want to understand whether, you could take part. If you couldn't, what was the challenges around that, how that's affected your working week, how that's affected your life. We do encourage our people, and they're very happy to talk to us. So they usually come in with a blog or a vlog, and they'll share their experience. I know that one of the major things which you kind of alluded to, and certainly it's not scientific research, but for us, the relationship building across the organisation has been dramatically improved, with the CEO saying, now I know somebody was walking down, near the cafes and the ice cream shop near my house, and next time I see them, I'm going to talk to them about that. And it just creates this much closer link and alignment with each other. So we have these lovely kind of feedback exercises that we then share with the organisation and the rest of the team. And yeah, it all gives us a warm, fuzzy feeling. But, from our engagement survey that we run every year, we know that last year headspace and worry was one of the concerns. So we've got a lot of people doing really weird and wonderful technical work with fishing. Don't even ask me, I haven't a clue. I don't know about people, not about fish. And they do all that, and they're really focused on that activity. So don't kind of pause. And so we created Place to Pause, which is absolutely about slowing down, but also go out, get some space, roll on the floor, whatever you need to do just to kind of have a break. That those results are now much better this year in our engagement survey. So we know that there are interventions that we've put in place that we're now seeing the results of that through our engagement work. So I think the data and the stuff is there for the clever academics amongst us to go and have a look at.
I think that's lovely, and I think that goes beyond permissions that we touched on earlier, and having that permission to do, which you've put in place, with the Place to Pause introduction. But it's also that you've invested in it. You've supported people to tell their stories and share that, and it's something you're continuing with. So I think that shows, not scientifically, but I think that shows that it's a priority within the organisation, and you're valuing your staff, which I feel must go a massive way in addressing that worry headspace point that so many of your colleagues flagged in that feedback. So it's lovely to see that reciprocity? That how have you reacted to that scenario?
Your point actually on scale up. I think one of the things that I think, just to your point, Sarah, that it's usually health and safety or HR who get in touch. We have a wellbeing group of wellbeing champions, and we kind of also give them permission to go into their teams and feed it out and get excited about stuff. So I do think there's a space for like champions and little pockets in these organisations that can spread the message of all the good stuff.
Making it part of certain people's role as well, and have that, again, permission to explore that with colleagues in a safe space. Really important. Thank you. Unless anyone wants to share anything else, I will bring that to a close today on active workplaces. We've covered a lot of ground within that, and I suppose not to finish on a down point, but before we close, I just wondered what challenges or barriers, as well as all the good stuff that we know is accessible to people and out there for people to do, what might be some of the barriers that you've come across within your work? Now, you've alluded to some of them already, but just before we end today, I wanted to make sure we captured some of that so that we can, think about those together as a network and as a wider conversation. Sarah, I'm going to ask you first. Any barriers or challenges, just a highlight from either the Walk at Work Award or Step Count?
There's there's a few challenges and barriers to encouraging people to be more active. One of I mentioned previously the pre and the post challenge survey that we always run for every Step Count challenge. In the last survey, I think it was 23% of respondents. We ask people about barriers and, what is it that's stopping you from being more active during the working day? And 23% of respondents answered that they didn't have enough time to go for a walk or be active on their break. So there's the structure of the day is one barrier. Depending on the workplace and depending on the type of work, a lot of employees don't necessarily have the time or even the headspace in some cases to just get up and go for a walk. Particularly in situations like hospitals, it can be quite difficult for busy staff to get away from their place of work. Call centres is another setting in which a lot of employees face real challenges in getting away from their desks long enough to be active. That is a big challenge. The other challenge that gets mentioned in my conversations with specifically HR professionals and health and safety professionals is cost as well. So the Walk at Work Award is a free to take part in award, and there is a small charge attached to the Step Count Challenge, and a lot of workplaces don't have much budget, especially small and medium enterprises. They really struggle to justify, and it does sound quite bad because it's staff wellbeing at the end of the day. It's an investment in your staff, but particularly the small and medium enterprise businesses really do struggle to find the budget to invest in their staff wellbeing. So yeah, that's a couple of the trickier challenges that I've come across.
Okay, thank you for sharing those. Lou? Maybe not within your workplace necessarily, but others that you might be aware of. What might be some barriers?
One of the challenges is to what we talked about earlier. How do we connect it in to things that are, considered to be out there and really important and people get? So sustainability or health and safety and welfare and well-being. Because I think sometimes still people think it's, that's just a nice thing to do and we'll have fun.
Luxury.
Bit of a kind of periphery, nice thing to do for your staff. Whereas actually, I think if we could really, crikey, I feel like back in time here where, I was doing engagement work and they were like, well, what's that? What does it matter? And you can really see the percentage of engagement going up, the productivity going up, your bottom line going up, and you had to present all the evidence. This is why. And you feel like you're still having to do that a wee bit, so what does it matter if we can get folk out for half an hour? You kind of still have to say, well, it's going to be great actually because they come back refreshed, they're far more efficient, far more productive. And you feel that you're kind of driving that a wee bit. So I think certainly not in our organisation, but I can see it across other organisations where, to your point, Sarah, they think, oh, I don't want to invest in that because what's my return going to be? And you feel like you have to kind of push them up a hill a wee bit to get them there. So I think kind of that leadership angle, that kind of strategic angle still needs to be in play. I think that's still a challenge.
Excellent. And that brings us on to evidence as well. So you're talking about presenting this is why. It brings me on nicely to Sam in terms of what challenges then might there be from your perspective, Sam, in terms of the proving that the evidence base and the research.
So for us, it's, there's some obviously physical activity is so intertwined with lots of other health aspects that a lot of the time is when we get to the even higher levels, the policymakers, where they then say, it's maybe not directly physical activity. But just to very quickly follow up from something Louise was saying there, is one of the big things that I think we need to maybe not normalize, but encourage people to see and open their eyes to is, because one of the things that came up in our research again was people were working through their work break because of the pressures of work.
Mm-hmm.
If you have if you have an hour work break and for 30 minutes of that, 5 days a week, you go for a walk, that's 3 30-minute walks is 150 minutes, and that's all that is the World Health Organization's recommendation guideline is 150 minutes. So you can quite easily implement that, or it should be easily implementable at work to sort of encourage people to, for 30 minutes of their of the day, just do some activity. But it's like you say, but trying to get people to see that and actually allow their employees the chance to not have to work through their work break. It is that.
Excellent. I guess that I was also wondering about environment for some people as well. I wondered if are there nice places to walk around someone's office, for example? Is it safe? Is it well lit as we come into darker? All of those things as well. Like with active travel, do I feel safer at certain times of the year walking in the dark to my work, etc.? So I guess there's a lot at play about, but the more we can communicate and evidence different ways of engaging people in different settings and with, lots of different options. As you say, Sam, it feels like it should be easy in theory, but it's maybe about just maybe hand-holding organisations a little bit more and evidencing things as much as we can. I'd like to thank you all for joining me today. I'm going to ask each of you to share a little bit of personal, what your movement for health is, if that's all right. A little bit of inspiration for our listeners today. And I'll start with Sam. I'm going to think it's some kind of competitive sport, but what's your movement for health, Sam? What do you enjoy most?
Yeah, you're right. I am. It is competitive. It's not quite as much football as it used to be, but I have decided now to play as much golf as possible, as I do. Of course, I'm in St Andrews, so while I'm here, if the sun's shining, I'm out there.
Excellent. Thank you very much. I was involved in a GP prescription program for golf last year, which was really interesting. So you enjoy your time out on the links. Sarah, what's your go-to movement for health?
My movement for health is most days I get outside for a lunchtime walk, even if it's just 10-15 minutes around the block. It's something that I've always done in every job that I've had. It's just a habit that I've picked up, and I always feel better for it. It really helps to just get away from the laptop, get away from the screen for that 10-15 minutes and get some fresh air. And it's got to the stage where it feels a bit strange if I don't manage to get outside my lunchtime walk. So
Mhm.
yeah, that's my movement for health.
Thank you. And lastly, Lou, what's your movement for health?
Recently discovered like a bit of CrossFit, and I am not competitive at all, in the slightest, which is hilarious because anytime I've done fitness, that's have probably been my downfall because I don't care enough. Discovered CrossFit, and in that room is like an hour of space. It is absolutely like my church. And that is where I can't think of anything else except lifting these heavy weights and jumping up and down like an idiot. Honestly, if there's things going on in my world, if I don't get there, then that's a frustration. So it's absolutely my headspace that benefits from that, as well as obviously feeling much fitter and healthier.
Lovely. Lovely. Well, thank you all for sharing your passions there and your expertise in the work that you're doing. And I look forward to maybe catching up with you all again in another episode where we can see how things have moved on, maybe pick up some of those challenges, seeing if there's any big breakthroughs in the world of active workplaces. And thank you for listening to today's Movement in Conversation podcast with our guests. Thank you to Sarah, Louise, and Sam. And if you've enjoyed it, please listen to the other episodes in the series looking at Scotland's 8 investments to see a more active, moving more culture in Scotland's workplaces, education, spaces, environment, etc. Thank you and bye-bye.